Medical Center of Plano. This is Katie. How can I help you? A dental? Yes, ma'am. I can totally do that. Can you tell me the name of your pet? And the last name? How do you spell that last name? Perfect. I see her on here. All right. Well, I do see that we already had previous blood work done this month, a young wellness, so she would not need any pre-op blood work done in-house on the day of her dental, whenever you would like to schedule that. When she does come in, we do want to make sure she's fasted. So we want to stop feeding her the night before at 5 p.m. and no breakfast the day of. A little bit of water is okay, but we just want to make sure she's fasted well for her surgery while she's under anesthesia. Yes, ma'am, and I can take a look and see. When would you be interested in scheduling that? Do you have a doctor preference? Dr. Cook? Yes, okay, so I do have an opening for Wednesday, May 6th. We can schedule that dental that day, and it would be with Dr. Cook. She does currently have 4 surgeries, but we would obviously give you calls and updates in between and before her surgery, or even if you're curious, you can give us a call and we'll be able to update you. Okay, perfect. I can schedule that right now. All right. Yes, and of course, yes, you're all scheduled, and blood work is done, so you don't have to worry about that. On the day of, we will ask you a few questions regarding dental x-rays. We do highly recommend them. I do see that her dental grade is a 2 out of 4, so it's not terrible, but we always recommend dental x-rays to make sure that if there is anything, we can catch it. Something that we can't see, dental x-rays helps us see basically underneath, the gum line. We can see the root, any absent. Yes, ma'am. Yes, of course. All right, well, you're all set. You have a great day. Bye-bye. Hello, how are you doing today?
Hi, I'm here to drop off Jackson.
Jackson, let me see here. Yes, I see. Okay, perfect. So he did already have blood work done previously, so we don't have to worry about that today. But we do have some questions for you. So we do always recommend dental x-rays. It is an additional $122. And we can also do a toenail trim and microchipping if you would like to do microchipping while he's under anesthesia if he doesn't have one. So whatever you decide today.
Yeah, I'll go ahead and do full mouth rods. He already has a microchip, but I'll get nail done.
Okay, perfect. And we will give you updates. You can call and ask for updates, and Dr. Cook will call you after she's done. Yes, ma'am.
Thank you, bye.
Yeah. Okay.
Is that your Visa card? That ends in 1674? Well, we can print out this, like, the scratch thing. We can print that to that, and that'll show you. But I don't know if Oh, yeah.
You grab that. We'll run a snap test. Grab it? Yeah, we're gonna run a snap test. Okay. So here's my fluid calculation for a dental that we had. So it's very easy. We'll just take our kilograms, and for us it is just 10 mils per kg. So for the first hour we do 10 mils per kg. For the second hour we start with 5 mils, or we go to 5 mils per kg. However, if they have some sort of heart condition, we go ahead and we start with 5 mils per kg first. So the calculation is super easy. We just multiply 10 times our kgs to get 67 mils for the first hour, and once that second hour hits, we're gonna want to go ahead and change it to 30 mils per hour. We don't always hit the second hour, but if we do, we go ahead and we do that. We're just using LRS fluid. This is in case, you know, the patient gets a cold. We can go ahead and hook up a fluid warmer to the line, and they start getting warm fluids to help keep them warm and prevent them from getting super cold. The only time we really use an active, such as like ketamine, is when there is a orthopedic surgery such as a TPLO, which we do not do here, or our doctors do not do here. We do have a doctor come in and do that. However, we just do LRS fluids for our surgeries. There hasn't been any additive as of yet while I have been there. In this shot, you can see that I have all of my calculations. So on the emergency drug sheet, the dose is actually much different than what Dr. Cook does. However, she told me the doses she likes to do, so that is where my math comes from. Again, she likes to go on the lower dosing side of things, and even with propofol, she likes to go on the lower dose of things, so she can give them more propofol throughout the procedure if needed. So this is what she ordered versus my calculations. They are very similar. But so she did round up for her propofol and for the Rimadyl. However, for the A, she just sticked with 0.06 mils, and then for the butorphanol, it's very similar. So yes, and that's. How are you doing today?
I'm good.
Are you here to pick up Jackson?
Yes.
Okay, perfect. So I do have some instructions to go over. He did receive a dental today.
Okay.
He will be going home with some medications. So for Rimadyl, he's going to go home with Rimadyl, gabapentin, and amoxicillin.
Okay.
Rimadyl is just an NSAID. Gabapentin may cause some sedation, and amoxicillin is an antibiotic. So all of these we are going to go ahead and start this evening. I do recommend that we start Rimadyl tonight at 6, and then gabapentin and amoxicillin is starting this evening. We want to make sure we give amoxicillin with food. All of this will be in the discharge papers as well as on the label for the drugs since they are handed to you. So there were some extraction sites, so therefore we're going to go ahead and feed soft food for the next 7 days. Make sure that we're allowing those extraction sites to heal properly. We can do a recheck in 10 to 14 days as well, just to make sure they're healing well. Or if you notice anything out of the normal, if the sutures don't look like they're intact, if you notice any abnormal amounts of bleeding, give us a call and we will schedule him. Dr. Cook can take a look at him for you. Do you have any questions for me?
No.
All right, perfect. Well, I'm gonna go ahead and check you out. Your total today is 966.
Okay.
Yes, ma'am.